I'm Dr. James Scheu of Metropolitan Plastic Surgery. Today we're going to do a fat transfer procedure. We're going to harvest autogenous fat from the flank, and we're going to put that in a couple of areas where there are intense, deep wrinkles or lack of volume. The wrinkles this patient has are in the chest area. It's because of a lot of sun exposure over the years. We've tried to do some fillers and they haven't lasted. She wants something that's more permanent. The nice thing about one's own fat is if it survives, it's permanent. So that's what we're hoping for. She also at the same time wants me to put a little bit of the fat into her lips to give her a little bit more fullness, and that's going to be done too. So this is going to be done under local anesthesia. She's going to have a little bit of sedation on board, but she is awake and she can feel anything that we don't numb up really well. So that's the setting for the procedure today. You'll get to see it in just a little bit.
The cheese grater means that we're going to be taking out small particles. So you can see the contour already changed a little bit. Now I'm going to go a little deeper. But we put the local anesthetic in there and let it sit for 40 minutes, so that's good. Should make it nice and numb for where we're working. Now I'm going to go with a bigger syringe. And she rotate just slightly for me. She's awake for all this, so she's doing great. No pain, right?
No.
Okay, super.
I'm getting small hips. I'm excited.
Do it over here. Next thing we do after we've harvested the fat is we're going to transfer the fat into smaller syringes. Like that. First thing we're going to do is we're going to let it sit and let the fluid component come out. And we're going to get rid of the fluid component. So we have just fat in there. So this is going to go into these 1 cc syringes, which is the right size for injection. We are now ready to do the fat fill of these indentations. So we have a really fine caliber cannula, which we're going to thread through a puncture that we made with a needle. And she really shouldn't feel hardly anything as we do this. Pressure. Can you see that? See how that curved indentation is already full? Did you see it? Mm-hmm. Showing up on the video? Good. Now we're going to get another syringe. And we're going to go down this groove right here from this puncture. As you can see, it's not sharp, it's blunt. So it has to be forced into that puncture hole. It's not going. Let's try a different cannula. Okay, so now down where that is, and we fill it very slowly, multiple passes. Thank you. So now you no longer see that dent. Shorter cannula this time. Maybe turn your head a little bit this way. That's it. So I get my hand right there. And now let's go to this little groove right here. All right.
Felt a little, but
A little pressure.
yes.
So I filled that dent now. The next one is here. Turn a little bit more. Thank you. All the way down to the bottom of the dent. Need a little bit more up the top part. Okay. Two more dents, two more syringes. Each of these syringes is about between 6 and 9/10 of a cc. Cc is a pretty small volume. We don't want to overfill these because we don't want to bulge them up too much. Although we have to overfill just a little bit because we know that some of it's going to settle. Okay.
Good.
Need just a tad more there and there.
The one that was a circle one.
That's done. I did
Oh,
that
good.
first.
Oh, thank you.
Did that one first.
Okay.
So let's get a little bit of fat from that area. Then we're going to go to the lips and do a little. All right, we're going to add a
Can I
little.
scratch my nose? Or?
We're going to add a little fat to her lips.
Under my
No,
lip.
no, no. Keep your hands down.
Oh, correct. You got it.
Got it? Okay. Open. So we're going to go through a small puncture that we made here and go into the lip. And I just do 1/2 per each entry point. So here we go, and I inject it very slowly as we back out. So that fat will be parked into good tissue. Go back and do a little bit more on the inside of the roll. All right, lips together. That's 1 cc on the bottom. Open again. Now we're going to go through the same puncture and go into the upper lip. Let's do that again. Push a little bit sometimes to get it to go through, because these are not needles, these are blunt tipped cannulas. So I'm all the way over to the center where she was worried it was going to be painful. Hurt ya? Super. Alrighty. Good. Move around to the other side. strokes. And distribute small little bits of fat as we go. Close. Now for the upper. Open. Close. You can see the lips are getting more full. I'm going to do about a half cc more in each. Okay, open. So that's a total of 4 cc's. I'm going to do a half cc in here. See at top. Same thing on the other side, extra half cc, open. And it will look a little over full because we know that some of the liquid part of the fat injection will be absorbed. Plus she's already had local anesthetic in the lip, and that makes them get a little bit more puffy too. Open. All right, close. Open, light down, lips together tight.